Welcome along to the Deep Dive, episode 189. Look, our mission is simple. Cut through all the noise, grab the most important bits from the latest in AI, and basically give you a shortcut so you're really well informed. I'm Amin.
And I'm Leah. Great to be here.
So today we've got some really big shifts to unpack. We'll be diving into Microsoft's huge step towards what they're actually calling medical superintelligence. Then we're pivoting over to China. Baidu's got this powerful new open source AI, ERNIE 4.5. It's really challenging the top models out there.
That's no one to watch.
And we'll also look at Chai Discovery. They've built an AI that designs working antibodies. It's a massive step for drug development. Plus, a quick rundown of other key AI news and some useful AI tools for you.
Lots to cover.
Absolutely. Let's jump right in. First topic, Microsoft's MAI Diagnostic Orchestrator, MAI-DxO. Now, this isn't just another tool. They're claiming it gets 4 times higher diagnosis results than experienced doctors on really complex cases.
Yeah.
Their CEOs calling it a big step towards medical superintelligence. I mean, that's quite a statement. What's actually going on under the hood here?
It is a bold claim, but the design is pretty fascinating. It's not just one AI. Think of it like a virtual medical team. You've got different AI agents doing specific jobs.
Okay.
So one generates hypotheses about what might be wrong, another picks the best tests to run, and there's even one keeping an eye on the costs. It's this collaborative approach.
A team of AIs. Interesting.
Exactly. And performance numbers, well, they really back it up. They use this benchmark, SDBench, with 304 really tough medical cases.
Right.
And the MAI-DxO, working with OpenAI's O3 model, that's their latest one, it hit 85.5% accuracy on diagnosis.
85%. Wow. How did the humans do?
Well, that's the kicker. A group of doctors, experienced ones with 5 to 20 years behind them, they averaged just 20% accuracy on their same hard cases.
20%. That's a huge difference.
It's a massive gap. And it really highlights the potential for AI in these complex diagnostic situations where, human reasoning might hit its limits.
But, I mean, is there a risk it becomes a black box? Doctors just trusting the output without knowing why? How do they handle the explainability side?
That's always the key question with medical AI, isn't it? The way it's structured with these distinct agents for hypotheses and tests, it kind of mirrors a human team's process. So it's not just a final answer, there's a simulated reasoning path.
Okay, so it offers some transparency.
It aims for that, yes. And this whole approach tackles a big problem in healthcare. Sometimes simple stuff gets overtreated while these complex cases get missed or underdiagnosed. This system could help fix that imbalance. Oh, and the cost savings. Also pretty impressive.
Ah, right. How much?
The AI averaged about $2,400 per case. The doctors, almost $3,000. So it's not just more accurate on these tough cases, it's potentially more efficient too. The numbers are, frankly, jaw-dropping.
Truly transformative potential there. Okay, let's shift gears now. Over to China and Baidu. They've just open-sourced 10 versions of their ERNIE 4.5 models. And the big one, 424 billion parameters. They say it beats DeepSeek v3, even though it's half the size. That's quite something, especially since Baidu wasn't exactly big on open source before, right? What's behind this change?
Yeah, it's a really interesting pivot. They've put out everything from tiny 300 million parameter models up to that massive 424 billion one. And crucially, they're all Apache 2.0 licensed up on Hugging Face.
So fully open.
Fully open. And yeah, you're right. It's a big change. Just last year, their CEO seemed pretty against the idea. This is Baidu's first major open source play.
So why now? And how are they getting that performance from a smaller model?
Well, part of the efficiency comes from their heterogeneous training architecture. Basically, the text and vision parts of the model are trained together in a way that helps each other out, making them stronger together than they would be separately. It's a more efficient use of the parameters. And competitively, that big model does beat DeepSeek v3 on most benchmarks, 22 out of 28, they claim. And the smaller ERNIE versions are also competitive against models like OpenAI's O1, GPT 4.1, and Alibaba's Qwen 3 on different tasks.
So they're really aiming across the board.
Absolutely. And the strategy shift, well, it really speaks to the fierce AI competition in China right now between the tech giants like Baidu, ByteDance, Alibaba, Tencent.
Right.
By open sourcing strong models, Baidu might be trying to sort of commoditize the foundation models themselves. It forces everyone else to compete more on the applications using the models rather than just having the biggest model. It's shaking up the ecosystem.
Fascinating strategy. Okay, from diagnostics and LLMs, let's move to drug discovery. Chai Discovery, they're backed by OpenAI, interestingly announced Chai 2. It's an AI that creates functional antibodies.
Yeah, this is really exciting stuff.
And the headline number is a nearly 20% hit rate. They say that's 100 times better than traditional methods, which are apparently less than 0.1%. How on earth are they achieving that, and what does it mean practically?
It really is a revolutionary step, moving towards design biology. The efficiency is just staggering. Think about it. They tested it against 52 different disease targets.
Okay.
For half of those targets, they found working antibody treatments by testing just 20 AI-designed candidates for each target. That's incredibly focused. Traditional methods would need to screen millions.
Millions versus 20. That's almost unbelievable.
And the speed. Traditional screening takes months, maybe years. Chai 2 did this initial success finding in just 2 weeks. It completely changes the timeline.
8 weeks.
Exactly. And another key thing, it designs them from scratch. It doesn't need lots of examples of existing drugs. It just looks at the disease target structure and designs a new antibody for it.
So it can create totally novel solutions.
Precisely. The researchers call it Photoshop for proteins. It lets scientists tell the AI exactly where on the disease target the antibody should bind. That allows for really precise therapies.
Photoshop for proteins. I like that analogy.
It captures it well, and the bigger picture here is huge for drug discovery. R&D costs are a massive barrier, especially for rare diseases where the market is small.
Right, the economics often don't work.
Exactly. But if AI, like Chai 2, can design effective antibodies quickly and cheaply from scratch, it fundamentally changes things. It turns drug discovery from a huge search problem into a targeted design problem. This could make precision medicines, even for rare conditions, much more accessible. It's enabling personalized medicine at a speed and scale we haven't seen before.
Incredible potential there. Okay, let's shift to our rapid fire round now, catching you up on other important AI news. We'll take these a little slower so you can soak it all in.
Sounds good. First up, Meta's finally given us some details on its superintelligence labs. It's being led by some heavy hitters, the former CEOs of Scale AI and GitHub.
Wow, big names.
Yeah, and they've also hired 11 new AI people, poaching them from Google, Anthropic, OpenAI. Seems like a major talent grab, especially with their Llama 4 model out.
Interesting times at Meta. Meanwhile, Apple is apparently thinking hard about Siri. Instead of building their own big AI model, reports say they're talking to OpenAI and Anthropic about maybe using one of their models inside Siri.
That's a big decision. Relying on a rival versus falling behind.
Exactly. Tough choice for Apple in the virtual assistant race.
And for developers, Cursor from AnySphere has a new web and mobile app. It lets you manage a team of AI agents to do coding tasks like fixing bugs or building features, even when you're away from your main computer. That's a big step up from just being in the IDE.
Makes sense. Handy for remote work. Also, heads up for the RAISE Summit in Paris, July 8th and 9th. Seminova CEO Rodrigo Liang is giving a keynote on open source AI. Seems very timely after our Baidu chat.
Definitely. And back to healthcare briefly. The Mayo Clinic has a new AI tool called State Viewer. It analyzes brain scans to spot 9 different types of dementia. They say it's twice as fast and 3 times more accurate than usual methods. Huge for early diagnosis.
That's fantastic news. And finally, Google's rolling out Gemini in Classroom. It's a set of AI tools for teachers to help with things like lesson planning, using NotebookLM, and even analyzing student performance. AI really branching out into education support.
Seeing it everywhere now. Okay, time for a quick look at some trending AI tools you might find useful.
All right, tool time. First, Hunyuan A13B from Tencent. That's their new open source reasoning model. Then Quenvilo from Alibaba. Think Fora-style image generation and editing.
Okay.
For music folks, Songscription turns audio clips straight into sheet music. Pretty neat. Pocacut uses AI to help you create nice photos easily. If you're learning to code, CodeFriends offers hands-on practice with coding and AI concepts. Voix is cool. It uses AI to separate vocals from instrumentals and audio tracks instantly.
Useful for musicians or karaoke, maybe?
Could be. Then there's MySite, aimed at small businesses for building websites without needing tech skills. And lastly, AnyNen helps you automate workflows using AI, very versatile for different tasks. Great list, lots of practical stuff there. So what a session. We've really covered some ground. From Microsoft pushing towards medical superintelligence and Chai designing antibodies like Photoshop, it's clear AI's impact on healthcare could be revolutionary.
Absolutely. Radically accelerating things.
And then Baidu's big open source move, really highlights the intense global AI competition.
Mhm.
Plus, all those other updates, Meta staffing up, Apple's Siri dilemma, new tools for developers, doctors, teachers. AI is just weaving itself into everything.
It really is accelerating everywhere, which, leaves us with a big thought to chew on. As AI gets deeper into healthcare and scientific discovery, what possibilities does that really open up? Not just saving money, but truly changing human health, solving problems we've been stuck on for ages.
That's the big question, isn't it? The potential feels immense. Well, make sure you follow the deep dive so you don't miss our future explorations into all this. And if you found today useful, please do share it with friends or colleagues who might benefit.
Yeah, spread the knowledge.
Thanks so much for joining us for this deep dive, and we'll catch you on the next one.